Welcome to the NICU Today podcast, a podcast to give families a new point of support as they navigate the NICU journey. Thank you for listening. Please don't forget to subscribe wherever you enjoy your podcast and share this episode with anyone who might find it helpful. Welcome to the NICU Today podcast. Very excited about our guest today. Dr. Allison Keen is currently a board-certified obstetrician and gynecologist at Philadelphia Women's Health and Wellness. She graduated from the University of Denver in Colorado with a Bachelor of Arts in Biology, and in 2003, Dr. Keen completed her medical degree at Drexel University College of Medicine in Philadelphia, Pennsylvania. Following her graduation from Drexel, Dr. Keen's postgraduate training included an internship and residency in obstetrics and gynecology at the University of Pennsylvania's Pennsylvania Hospital in Philadelphia. After completing her training, Dr. Keen was an attending physician at Abington Memorial Hospital for 13 years. In her final 4 years there, she held the administrative role of lead physician. Dr. Keen and her husband have lived in the East Falls area of Philadelphia since 2005. They have a 16-year-old son and a 12-year-old daughter. She enjoys running, hiking, reading, and watching her kids play sports. As a practicing physician for 17 years, Dr. Keen prides herself on being a patient advocate to assure her patients receive the highest quality and safest care, which is so true. And happy to have you here. Welcome, Dr. Keen.
Thank you for having me, Martha.
Well, talk to us about why you chose obstetrics and gynecology. What took you down this path?
Well, it really started when I was young. My father was a minister. I grew up in a small town in Colorado, and I spent a lot of time actually in the nursery at my father's church. And I really had this natural instinct to take care of babies. And I was actually babysitting by myself by the age of 10. And then another influence I had was in a small town in the 70s, we had a physician that took care of my entire family. He was a pediatrician. He took care of adults. He delivered myself, my siblings, took care of my mother during pregnancy. And I think he was a big influence on me. And I thought that was really kind of where I wanted to go. I didn't really know what all that meant, but we then moved to Texas, and in high school and college during the summers, I had this great opportunity to work in the operating room at a hospital in Dallas. And I was actually what they call a retractor holder. So I held instruments during surgeries and really found that was really a good desire for me. And when I went to med school, I basically realized that all of that encompassed the specialty of OB/GYN. So I was able to deliver babies, take care of pregnant women, and operate, and also just really form amazing long-term relationships with my patients.
Well, and in full disclosure, Dr. Keen has taken care of our family. She delivered all 4 of our children, and we've been through a lot together, as she knows. But and that's a big reason why we wanted to have you on this podcast as well, because it's a challenging time. We say all the time, families feel like they get pregnant, they have a baby, and they start a family, which happens at times. For a lot of us, that is not our path to starting a family. But what is your biggest piece of advice for your patients who are pregnant for the first time?
Sure. I mean, in general, I think my first advice is to enjoy it. I think that there is so much out there that can cause a lot of anxiety for patients. And I really encourage people to be in the moment. I do know things that bad outcomes do happen at times, but in general, I think to be as relaxed as you possibly can, listen to your doctors, go with their advice. I think people tend to get caught up in the details sometimes and end up not really enjoying the day-to-day of that process. Having said that, I think, you also don't want to read too much on the internet, to be honest. I think that there is so much information out there that's overwhelming and can cause a lot of anxiety that probably people shouldn't be reading. So I would also encourage that.
Well, and I know there were some books out there that I had read, and I always say I wish I hadn't relied on those books as much as maybe I did, because when you think about it, that is what you're for, right? That's what your OB is for, is to reach out and to ask questions. And
Yeah,
many of our listeners may not experience a full-term pregnancy, and especially being a first pregnancy, have no idea what to look out for. So I wanted to ask you, what are symptoms that you would tell people to look out for or be aware of, and when do you call your doctor?
right, right. Um, First and foremost, I would say any unusual abdominal pain. Some people may recognize that as uterine pain, but they may not. So certainly anything that's unusual, persistent, getting worse, you want to call your physician about. Any sort of vaginal bleeding at all, anytime during the pregnancy, is an absolute reason to call your physician and have an evaluation. Any leaking of fluid where you could have broken your water early, and any decreased fetal movement. Usually when we're 20 weeks and over, you want to let your physician know about.
And really, I think you can also call whenever you feel like it, right? If you have
Absolutely.
any questions.
Yes, I mean, speaking for the practices I've been involved in, there is a physician on call at all times, whether that's just having a conversation or having you brought into the hospital. I think, a lot of what we do is reassuring patients or deciding, triaging whether they need to be evaluated or not.
But always call if you have a
Yes.
question. Oftentimes look back and say, gosh, I wish I would have called sooner, or, you're not bothering anyone.
Yes.
Definitely reach out and give
And
a
you're never
call.
wrong if you think that something is, it either is or isn't, and a doctor should advise you accordingly. Yeah.
Yes. Okay. Delivering the baby, post-delivery, NICU admission, unexpected stay in the NICU. I mean, I think back to when Claire and Mary were born, 23 weeks and 5 days. I didn't talk to you for a little while after that. How do patients make sure their doctor is aware of the early delivery? What is going on? Do you always receive that information from the hospital necessarily?
I would say no. Um, to be honest, I think it's not a problem, but I would say there's not a best practice from the institutions that I've been involved in probably out there for this exactly. And probably part of that's because of the way obstetrics is sort of run these days. So, for example, an OB will be on call, say for 24 hours. When that 24 hours is over, yes, we probably know if somebody's going straight to the NICU. But those NICU docs are busy taking care of those patients, so they're not necessarily wanting to communicate with us because they're tied up. Sometimes we're around where we can ask, but often what happens is that person who's on call delivers that baby. That person goes home, goes to the office, goes to the OR, and a new person comes on, and those are the people that typically see the mom in the postpartum, and they're the ones getting that information. And I would say that oftentimes there isn't a streamline for that for the delivering physician to get that information, unfortunately. I would say in my experience, most of the deliveries that I found were either straight to the NICU or later I found out at their postpartum visit.
Do you feel as though, as an OB, and I have this conversation with another friend of mine. We actually were just working together to help support one of her patients. But do you think there is an opportunity uh, to improve that communication? I mean, is there should families call right away? I didn't think about calling you, to be honest. I mean, when
Right.
you knew what was going on with us, but I didn't think
I
about
haven't
calling
always
you.
known.
Right.
Some I have not kept so, well tracked. But I would say in the there's a lot of portals out there now, and possibly sending a message to that physician through the portal, just an FYI. Again, that's work on the mom that, is, a little complicated. But yes, it would have to be, the NICU doctors and the OB practice to sort of figure out how that communication would happen. I think, unfortunately, it is complicated. I mean, I don't like walking into a postpartum visit not really knowing. So certainly that would help us to prepare for that visit, because I know times when we didn't know and you walked in and, things were not going well or whatever. And that's, hard on us to present like that. But yeah, I think it would be, but I think both organizations would have to get together to come up with that, because NICU would have to communicate with us or the parents. I don't know that it necessarily should be the parents either, because there's a lot going on in all three areas.
And I think what's important of what we're talking about right now too, though, is as a parent, when we lost our son William, you did know, but some OBs may not know that their patient has lost their child. And so as the patient going in, it's important that you know that there is a chance your OB might not know. And so to let them know that, be prepared that you might be sharing that news with them. Now, I did want to ask you, so when a family is finished, they say, hey, we're done. We're not going to do this again. We have our family together. What are some of the questions that they should ask you for that next chapter that they're going into?
Well, mostly, I mean, that would probably entail discussions about birth control. And there are a myriad of options out there. Some people are done in their 20s, 30s, 40s. Each decade of life presents a different myriad of symptoms. And so putting that together with finding the best method to prevent pregnancy in that person's situation is the questions you want to ask. What are the options? What are all the options? What are the risks of those options and the benefits? And then weigh all of those and find what is the right fit for that patient.
But again, it's asking questions, researching with your doctor, talking about the different options that are out there, because there are so many different ways you can go. Yeah.
Right. And they can also help symptoms of, our menstruation and all of that, along with being methods of birth control. So I sort of put those together with each decade, whatever's happening with that patient, and if there's any other things that need to be managed.
Now, another really scary time for families, and knowing from personal experiences, after you've had a premature birth, and for us being so premature, and then thinking about having another child, personally, we waited for an extended period of time before our daughter, Martha Rose, we found out we were pregnant with her. But when someone who's gone through the NICU or had that traumatic experience, or even had a loss, or, any type of traumatic experience, what advice do you have for them when they think about having another child?
I would say that there's many different reasons why people have preterm births, and without going through them individually, statistically, most patients end up not having a repeat. Having said that, there's a great deal of anxiety around that next pregnancy. And so I certainly try to acknowledge that. I think I would encourage a patient to be absolutely ready, because there will absolutely be an element of anxiety. And so you want to be able to be present in the moment of that next pregnancy. There's also protocols for it, any reason why somebody had a preterm birth. There is a future protocol that patient will be monitored more closely for. And so you want to share that with that patient. They can ask questions about what that is, what the time commitment is, because it's often more time. Sometimes their risk factors are so extreme that we advise them to see a maternal fetal medicine specialist for preconceptual counseling for that particular history, so that they are even more educated on what their risks are, and what the protocols would be.
It can be a very scary time. And also, if you welcome a baby prematurely right around that time that the baby comes. I remember it was right around 23 weeks and something happened and I went, oh, I have to go in. And the nurse that was working with me in the ER said, "Oh, we see this. We see this sometimes," because it
Oh,
was right around the time Claire and Mary were born. And it probably subconsciously, I was thinking, uh-oh, right?
I think there's milestones that patients get through. They're like, okay, you got past the 23 mark and things look better, right?
Hmm.
I do think that as a physician, I don't do obstetrics anymore, but anyone who'd had an experience in the past, I found to have a low threshold to have somebody come in to reassure them, even if it was minor, it's better for a patient to reduce their anxiety about the things they've gone through than to have them out there worrying, in my opinion.
Yes, absolutely. All right. You have delivered a lot of babies and worked with a lot of families, but talk to us about a meaningful moment or an experience that has stood out to you over all of these years.
Sure. I mean, not to sound cliche, but I would say that your family's journey has been absolutely one of the most memorable, mainly because number one, I started with you at your very first prenatal visit, followed you through the twins, delivered the twins, and we were able to make it happen with Martha Rose and with William. And I will forever, have you all in a special place in my heart. But I do say that some of the losses or the preterm deliveries have stayed with me. A lot of those moms have had such a bond with me that they've stayed with me as their gynecologist, which I find amazing and so special that I get to continue to see them talk about, their children or their, some had losses and then their future children. So that has just been part of my job that I absolutely love because I continue to see people year in and year out. And I love the patients have followed me with that experience into their, next stage of life. And, I have had, crazy deliveries that I continue to have a relationship with those patients. So in general, it's not necessarily specific, but I have many of those that I cherish.
Well, you have made a big impact on a lot of us. That is for sure. Anything else you want to share with the listeners? Anything we didn't cover?
I don't think so. I'm just really thrilled to be here and be a part of your organization and being able to speak today.
And now you are not delivering babies any longer, but you are still a gynecologist, still working with patients. Where can listeners find more about your practice here in the Philadelphia area?
So I currently have a practice with two other women, and it's called Philadelphia Women's Health and Wellness. And we are here in East Falls there was an old MCP hospital building, and we're located in there. And we've opened our doors October 1st of 2020.
Wonderful. Well, thank you again, Dr. Keen. We're thrilled to have you on the NICU Today podcast. Thanks for sharing so much with our listeners.
Thank you. Nice to see you, Martha.
Thank you for tuning in to the NICU Today podcast, brought to you by Today is a Good Day. Learn more at todayisagooddday.org.